Good afternoon. Welcome to the Center for Disaster Philanthropy webinar, The Global Hunger Crisis, Risk of Famine in the Horn of Africa. My name is Regine Webster, and I am the Vice President of the Center for Disaster Philanthropy. My pronouns are she, her, hers. I was the founding executive director of CDP, and I like to think that I bring a sense of adventure, discovery, and compassion to the fields of philanthropy and humanitarian assistance. Now, some housekeeping notes before we get started. First, you can submit questions to us at any time using the Q&A box at the bottom of your screen, and we will answer them at the end of the presentation. And if you're on Twitter, please go ahead and use the hashtag CDP, the number 4, recovery. So CDP for recovery to share and join the discussion. And of course, don't forget to follow us on Don't forget to follow us at Funds for Disaster. Now, at the end of the webinar, there'll be another short survey. We'd really be so grateful if you'd complete that survey. It helps us improve our work and our webinar offerings so that they better meet your needs. And then finally, as you heard when you joined the webinar, we are recording this webinar. This will be available on our website and on our YouTube channel, probably tomorrow or Monday, once our live captioning is complete. We do have live captioning now available via Zoom. You just click on closed caption live transcript to access it. More accurate captions will be available in the recording when we post that. This webinar is being co-sponsored by Alliance Magazine, the Council on Foundations, Giving Compass, the Network of Engaged International Donors, and Philanthropy New York. We are so thankful for their support as we put this webinar out. As we begin this webinar, I'd like to go ahead and do a land acknowledgement. CDP acknowledges that we are working from the stolen lands of the many original peoples. We recognize that Indigenous peoples have been displaced and disenfranchised from their land by the socioeconomic and cultural disaster of colonialism, as well as disasters. We acknowledge when the United States was founded, there were exclusions and erasures of Indigenous knowledge about how to appropriately care for these lands, causing environmental destruction and degradation, which has had a significant impact on disaster risk and on communities. We are committed to dismantling the ongoing legacies, systems, and structures of settler colonialism and white supremacy. We commit ourselves to understand where and how wealth accumulation has harmed people and the earth itself, and the complexities of philanthropy as connected to that truth. Despite centuries of theft, violence, and murder, this is still and always will be Indigenous land. Please join us and acknowledge the original peoples and their elders, past and present, as well as future generations. Moving now, I just want to share some goals that we have for this webinar, right? At the end of this webinar, my hope is that you all will understand how global factors, including conflict, climate shocks, COVID-19 inflation, and supply chain shortages made worse by the war between Ukraine and Russia, have impacted hunger worldwide. I also hope that you'll understand how the slide into famine is man-made and preventable, making this one of the most urgent crises for funders to respond to in 2023. And then lastly, I hope that you'll leave understanding why it's critical that funders act quickly to support emergency recovery, resilience programming to save lives, prevent unnecessary suffering, and strengthen affected communities' ability to adapt and cope with further shocks. Before I dive into the poll results, I want to acknowledge the fact that all of us here are as interested and invested, or likely as interested and invested into the situation of the famine, but are torn by the media reports of the very devastating earthquake that has struck Turkey and Syria. So while my head and my heart are very much in this webinar and very much wanting to convey what we know to be true about this pending famine, I also am very torn by what we're seeing, hearing, and learning from our humanitarian colleagues in Syria and Turkey. And we'll touch base on how CDP is responding to that and the webinar that we'll be hosting next week at the end of this call. All right, let's go ahead and take a look at the poll results. Okay, so, all right, it looks like 50% of the folks on this call have been paying active attention to the current famine risks. That's great. And it seems like, a quarter of our participants here have responded to hunger and worked to prevent famine. All right, well, I'll be very interested to see how over the next 53 minutes, if our panelists help provide you all with some intel on how to support the current hunger crisis. So now it's my honor to go ahead and introduce our special guests. I am really looking forward to the information that they're going to share with us. Lisa Doughton is the Director, Humanitarian Financing and Resource Mobilization at the United Nations Office for the Coordination of Humanitarian Affairs, OCHA. She brings 30 years of experience in international humanitarian and development assistance, and this includes 18 years in various capacities in the field and at headquarters with OCHA, UNICEF, UN Women, and the World Food Program. Prior to joining the United Nations, Ms. Doughton worked for a private sector consulting firm from 1999 to 2003, during which time she designed and implemented disaster preparedness and response plans for governments in Africa, Latin America, and the Middle East. Rain Paulson was appointed the Director General of the Food and Agriculture Organizations of the United Nations, aka FAO. As Director, Office of Emergencies and Resilience in June 2021. Immediately prior to joining FAO, Mr. Paulson served as Director ad interim of the Coordination Division at UN OCHA in Geneva. With extensive experience in the non-governmental organization sector before joining the UN, Rain has worked with Adventist Development and Relief Agency International, World Vision International, and Southern Africa Food Security Emergency Response based in Johannesburg, South Africa. I don't know, Rain, if you remember, but you and my paths used to cross 20 years ago when you were at World Vision and I was at the Bill and Melinda Gates Foundation. So I will say it is very, very nice to be in the same room with you again, the Zoom room, if you will. Winfred Wangari, welcome. Thank you so much for joining us today. Winfred is the East Africa Program Manager for ORAM, the Organization for Refugee, Asylum, and Migration, which is a pioneer in advocating for the protection and well-being of extremely vulnerable LGBTIQ refugees and asylum seekers globally. She has a decade of experience working in the humanitarian sector with a focus on advancing the economic and social development of displaced populations in Kenya. As the East African Program Manager for ORAM, her main role is designing and coordinating ORAM projects in East Africa, supporting LGBTIQ refugees and asylum seekers. Welcome so much to each of you, and thank you for taking the time to share your expertise with us. All right. Global hunger and the risk of famine is an area of significant concern for CDP. Over the last couple of years, an increasing number of organizations have raised their fear with us that a famine was pending across the Horn of Africa. Last July, we initiated a Horn of Africa disaster profile, as well as a global hunger crisis fund. Our international grant-making team has made several grants to respond to the crisis, and you'll hear from Winfred later, who will talk about one of those grants. First, I want to go ahead and invite Lisa and Rain to help me frame the conversation and help us understand what the United Nations is doing to address the crisis. So Lisa, let's go ahead and start the conversation with you. Could you talk to us about the broader issue of global hunger? What's the role of OCHA and what's happening now?
Yeah, thank you so much, Regine, for the introduction and for hosting this webinar, and for all of the members' interest in this, because it takes that to make sure everybody is more aware of this issue. I would start by saying last year, over 45 million people, mainly women and children, were on the brink of starvation in 37 countries. As many as 222 million women, men, and children in 53 countries faced high levels of food insecurity, so even more of that. Most concerning was the almost 1 million people living in famine conditions at serious risk of starvation and death in several countries. We are hoping not, but in 2023, the situation may be even worse. These figures are only indicative, as they'll never fully reflect the situation on the ground, but it's not about the numbers. It's about the dramatic and devastating impact hunger has on people and communities. Hunger ravages people's health and well-being on every level and makes them vulnerable to various diseases and undermines their ability to work and take care of their families. Women and children are the worst affected, often facing additional risks such as sexual exploitation and abuse. For children, the adverse effects on their physical and mental development can really last a lifetime. This global hunger crisis is driven by multiple factors, including conflict, which remains the main driver of food insecurity, as you mentioned, man-made, climate change, and the effects of COVID-19 and rising global commodity prices. All of these are drivers. Secondary impacts of war in Ukraine are also among the drivers of food insecurity, with the most vulnerable communities now facing skyrocketing food, energy, and fertilizer bills. Combating hunger and food insecurity is central to OCHA's efforts to coordinate timely and effective humanitarian action globally. And for those of you who are not so familiar with OCHA, as Regine said, I work with the United Nations Office for the Coordination of Humanitarian Affairs. Our mandate is given to us by the UN General Assembly, the United Nations General Assembly, made up of the states and governments, is to coordinate global humanitarian response to save lives and protect people in crisis. So we work closely together with partners such as the World Food Program, Food and Agriculture Organization, where RAIN works, UNICEF, and many others, including local, national, and international NGO partners, to bring life-saving aid to people in need. Our work includes a range of different efforts, including mobilizing and coordinating humanitarian system, liaising with member states of the UN and donors to provide the much needed funding for operations, conducting humanitarian diplomacy, high-level advocacy and awareness raising, and calling for collective scaled-up investment in climate adaptation and large-scale development assistance. So, and just lastly, just to give a concrete example of OCHA's work in this area, and with thanks to public and private humanitarian diplomacy, which includes briefings to the United Nations Security Council, more than 20 million metric tons of food have been moved from Russia and Ukraine under what is called the Black Sea Grain Initiative. This includes 426,000 metric tons of food moved through the World Food Program to support humanitarian operations in Ethiopia, Somalia, Yemen, and Afghanistan, all countries at risk of famine. So thank you, Regine, and back to you.
And I'll go ahead and ask a similar question of you. Can you share with us what the role of FAO is in famines, and what are you currently paying attention to?
Thank you very much, Regine. Thank you for the invitation. Good to be online and good to see you again. So the Food and Agriculture Organization of the United Nations is the UN's lead specialist agency for food and agriculture. And in situations of crisis, this means that FAO provides time-sensitive agricultural support that's essential for the survival of vulnerable households. Briefly stated, what we do is help people to produce nutritious food themselves as fast as possible. This is important because when we look at acute food insecurity globally, we see that at least 2/3 of people experiencing acute hunger, the most severe form of hunger, these people rely on agriculture for their survival. In certain countries, that percentage is even higher. In South Sudan, about 95% of those experiencing acute hunger rely directly on agriculture for survival. In Somalia currently, the threat of famine is real. And those at most risk of famine are predominantly living in rural areas, connected often to livelihoods such as herding, and their survival depends on the health, well-being, and survival of their herds. Their children's nutrition is intimately linked with the health and productivity of their animals. Unable to produce milk, those animals have been dying at a shocking rate, and as a consequence, people have been affected. So important for all of us, and this is what FAO is concentrating on, is to understand people in their situation, the way in which they derive livelihoods and what they require to survive and thrive. And important also to recall that even in the most extreme situations, all people have a livelihood on which they can depend or which they have depended. And so our ability to support them to produce for themselves, produce nutritious food, is both a cost-effective and time-sensitive set of interventions. So This is very much the type of work that FAO is focused on. I'll give a couple of quick examples just to bring this work to light. Many on the call may recall what had been unfolding in the northern part of Ethiopia in Tigray. Since 2021, blockades and fighting had severely restricted access to that part of the country. Very little life-saving assistance, international food aid included, was getting in. But despite limited amounts of funding going to agriculture, FAO was able to support local farmers, work with local authorities to produce 900,000 metric tons of food. It's a big number. Just to put it in context, that's enough food to supply the population of Tigray for about a 6-month period. So incredibly impactful work. These then are the things that we're focused on: dignity, cost effectiveness, efficiency, but ultimately making sure that people are able to survive, strengthen their resilience, and thrive into the future in challenging circumstances. That was a little bit about FAO. Just very quickly here to say the importance of this work now is growing, unfortunately, because we're seeing that hunger trends are also increasing and intensifying. You can see on your screen how those numbers have been growing year on year, absolute numbers increasing. You see them on the screen. I won't repeat them for you, but I should say that we are very concerned as we look now to the outlook for 2023. The number of people who are facing what we classify technically as emergency conditions, something that we call IPC4, is at unprecedented levels. The numbers have soared in the last 7 years. And as of January 2023, we have 6 countries where we also have populations in the most extreme circumstances, what we call IPC5. Those are famine-like conditions. These are people that are living with the threat of famine. So we're concerned about the coming period. Projections are pointing to a possible deterioration with the evolution of what's known as an El Nino event. Many of you are probably familiar with that. Projections are that may well materialize in the second half of 2023. It means different things in different parts of the world, but will impact Southern Africa, West Africa, the Central American dry corridor region with dry spells, flooding perhaps in other parts of the world. So these are big challenges for us. And I should say, as you mentioned, Regina, at the top of the call, we're focused obviously on anticipatory action, on famine prevention and response, but we're also deeply, deeply concerned about the consequences now with the tragedy of the earthquakes in Turkey and the impact on the region, and looking to support governments and partners there to respond to the food and agriculture needs as those individuals are trying to get back on their feet. Let me stop there and hand back to you, Reggie, and thank you.
I appreciate you bringing into the conversation, Rain, how our humanitarian system is interwoven, and they are inextricably linked, and one catastrophic disaster has implications for another. So I'm really appreciative of how you brought that all together. Famines, as we know, can be prevented, but we often see funders really waiting until there's a famine announcement on the horizon. How would you encourage funders to think differently about this, Rain?
So this is one of, I think, the most important questions we're grappling with. And, unfortunately, despite the fact that our early warning systems collectively, the evidence that we have that gives us an ability to map out the evolution of potential famine situations, despite the fact that that work has expanded and is covering more countries and has incredibly refined analysis, we simply don't get to the anticipatory action that we need at scale as consistently as we need to see. Famines never come out of the blue, let's be clear. There is always ample warning time across the humanitarian situation. And indeed, when we think about what's been happening in parts of the Horn of Africa, Somalia, parts of Ethiopia, parts of Kenya, we had early warning signs after just a couple of challenged and failed seasons. it didn't translate into anticipatory action at the scale that we needed. And part of what we're encouraging institutional donors and partners to focus on is concentrating on financing that is linked to objective triggers. In other words, trying in a sense to remove some of the levels of human decision making to allow for a more triggered, timely, automatic response. This doesn't mean that we don't need a good judgment in the allocations of funding as it comes online, but it's to say that because we and partners know what types of interventions are required from a multi-sectoral perspective between agriculture and food aid and nutrition and health and water and sanitation, what those combination of activities look like when they're needed, our ability to move at scale is significantly enhanced if funding is available, typically also pool funding, and I should say OCHA areas also under specifically under Lisa's responsibility are really leading the charge in terms of the value of pool funding mechanisms. We need more flexible financing mechanisms that are connected to triggers that allow us to move quickly as situations deteriorate, rather than being driven in the first instance by fiscal years or funding cycles. So those are certainly areas on which we're focused as we're moving ahead. And I should say, you know, for us, this is first and foremost about responding to human situations and to enable human survival and to promote dignity, to allow people to thrive and strengthen their resilience. Our ability to move early, to have anticipatory action at scale, is infinitely cheaper and more cost effective than having to mount a large response when a crisis hit. Experience shows us that if we have to respond at scale after a disaster breaks, after we're in the midst of famine, this is typically 7 times or even more expensive than anticipatory action at scale. So it makes human sense, it makes technical sense, and it makes financial sense. So these are the challenges on which we're working, focusing on this no regrets at scale action. I said that there's nothing surprising about the evolution of famines, and I think that's true. I should also say that we know collectively as specialized agencies and partners how to prevent famine. We understand the programming approaches that have an impact. It's this critical element of timing of funding, the nature of funding, the sequencing of funding that really makes the difference between a successful response and a prevented famine or a crisis.
Rain, I so appreciate your wisdom there, right? We have the idiom in English. I actually think it translates into several other languages as well, right? An ounce of prevention is worth a pound of cure. And we've known for a long time that in any humanitarian system, the ratio of prevention dollars to response dollars is 1 to 7, 1 to 14, 1 to 21, depending upon the circumstance. So I really appreciate you drawing that out. Lisa, I actually want to ask you the same question that we just asked Rain. We know famine is preventable. What do you think that funders should be doing now?
I had to find my my mute button. There have been so many different lessons learned from the past, including that the famine in Somalia, 2011, and again in 2017. And I just want to go back to one thing that Rain was saying about it being a multi-sectoral approach, and that's really important because in 2011, I was working with UNICEF, and we had Somalia at the brink of famine. And that was something that UNICEF, as somebody that also coordinates on water and other multi-sector, was making the point. And so that's a really important point. I wanted to underscore that point that Rain had made. But I'd say first, the world has to support humanitarian agencies to bring the much needed aid, including food, nutrition, water, healthcare, and other support. This requires, going back to something else Rain said, this requires early, flexible, and unearmarked resources for humanitarian action, because not having enough funds force humanitarians to prioritize and essentially take food from the hungry to feed the starving. So it's as you can imagine, an incredibly difficult dilemma. The World Food Program is constantly having to cut rations to different countries and making that very difficult decision, who gets fed and who does not get fed. Furthermore, delays in funding also cost lives and makes the response much more expensive. So this is why OCHA advocates and mobilizes resources for its global and country-specific humanitarian funds, also that Rain had referred to. We pull the resources from governments, from private sector and individuals to have them ready to respond when these needs strike. So in 2022, OCHA received and allocated over $2 billion to international, national, and local responders, whoever is best placed to address the highest priority needs. And FAO is one of those big recipients as well. These pooled funds ensure we can respond very quickly in as little as 24 to 48 hours, as just seen in the Turkey-Syria earthquake response, where the global fund, which is called the Central Emergency Response Fund, has already allocated $25 million. That's a drop in the bucket. But it may very well do more, but that's to really kickstart the initial response and allow those that are on the ground right now to use that money to jumpstart the assistance. I also wanted to note that the SERF, the Central Emergency Response Fund, and 20 other the country-based pooled funds provide the crucial resources to the neglected crises that are not in the headlines. So we see Ukraine, we see Afghanistan, we see Turkey and Syria. There's so many that need this assistance. So also looking at those underfunded or protracted crises. Early funding is critical this year, as it is every year. We can't repeat the mistakes of last year when funding for Somalia fell so drastically short. So by halfway through the year, the available funds were shockingly low for a country at an imminent threat of famine, which impeded efforts to put in effective preventative measures to mitigate the food crisis. So even by the end of the year, the Somalia Humanitarian Fund, which is one of those country-based pooled funds that OCHA manages on behalf of the system, it only reached 8% of the multi-sectoral needs laid out in the country's humanitarian response plan, which is a coordinated plan at that country level. Of course, that goes beyond food, as I mentioned, to water, sanitation, hygiene, education, health, and other critical needs. Excuse me. So, when just to maybe elucidate it a bit more. So when you don't have this multi-sectoral response, then those that have recurring malnutrition also have a heightened vulnerability to death by disease because of the lack of these other services and basic services. Another point is that we have to address the drivers of acute food insecurity and build the resilience of families and communities to prevent famine risks from occurring. We need concerted diplomacy and political will to end these conflicts, to improve disaster preparedness, address climate risks, and ensure climate financing and solutions reach the vulnerable countries and the people. And more importantly, we need more large-scale development assistance to be directed to the fragile and crisis-affected countries where the needs are greatest, and to help us reduce the humanitarian needs and build resilience in a more sustainable way. So just maybe to mention one data point. So according to the Global Network Against Food Crises receive substantial amounts of humanitarian development financing to food sectors every year. But despite the growing amount of humanitarian assistance, which is not keeping up with the needs, I must say, but despite the fact that there is a generosity that has increased the humanitarian assistance, per person has decreased from $85 per person in humanitarian assistance to food sectors in 2018 to $51 in 2021, largely because the pandemic diverted finance away from the global hunger crisis. So that's a 40% decrease of assistance going to food. And finally, I wanted to note that debt will become more unsustainable in 2023, with about 60% of all low-income countries now either in or at risk of debt distress, which is driven by the food and fuel crisis set off by the war on Ukraine, high inflation, currency depreciation, et cetera. And with that in mind, there's an urgent need for debt restructuring and financing in 2023. But just to maybe say, I'm not speaking on gloom and doom, because despite the ongoing challenges in Somalia, 7.3 million people were reached with humanitarian assistance in 2022. And the scale up of humanitarian assistance and efforts of local communities have prevented famine for the time being, but the underlying crisis has not improved, and even more appalling outcomes are only temporarily averted. We have consecutive poor rainy seasons and another one sort of forecast to come. So We have to remember that the people affected by successive droughts in Somalia are the face of the global climate emergency. So while humanitarians prioritize life-saving assistance, it's also critical to invest in livelihoods, resilience, infrastructure development, climate adaptation, and the like. And support for humanitarian response has to be accompanied by financing for these areas. So I'll stop there and back to you, Regine.
Lisa, you touched on the different population question. Let's talk a little bit more about that. We know that regrettably, in any humanitarian crises, they have more specific impacts on certain populations. How is that playing out in this hunger crisis right now?
Yeah, so I was just talking about climate change a bit. So climate change and weather-related events represent the second driver of food insecurity after violence and conflicts, which I mentioned when I was speaking the first part. So more than 3 billion people currently live in hot spots with high vulnerability to climate change. There's been a huge increase in weather-induced shocks in recent years, and by 2030, we might have as many as 1.5 disasters every day. I mean, that is real. You were seeing the increase of heat waves. We see very odd weather events, and there's been this huge increase in those shocks in recent years. So, this does not include the long-term effects of events such as protracted drought and the long-term effects of already existing climate events. So when food insecurity rises, I think specifically I wanted to note women and girls are at the highest risk of hunger and violations of their rights. Globally and in every region, the prevalence of food insecurity is higher among women than men. And in many humanitarian contexts, access to food is extremely gendered, with women and girls eating last and unfortunately the least. For example, in 3 of the countries of the Central to Sahel region of Africa, in Burkina Faso, Niger, and Mali, households headed by women are specifically excluded from access to available food resources. And according to Plan International, in Haiti, women receive smaller portions of food than men, and girls receive smaller portions than boys, even in the same household. So food insecurity exacerbates the risk of gender-based violence, what we call GBV, particularly for women and girls, but it's not exclusively women and girls, of course. As we also saw during COVID-19 lockdown, these additional risks manifest in different forms of GBV, including higher levels of intimate partner violence, sexual violence and harassment, exploitation and abuse, and child marriage. Various dynamics are at play here. And I'd like to mention 3 of those. So first, economic vulnerability due to hunger and food insecurity leaves women and girls more at risk, as I mentioned, of sexual exploitation in exchange for food, and engaging in transactional sex. Secondly, women and girls in drought-affected areas are more likely to have to fetch water from longer distances, which makes them more vulnerable to violence and abuse. Excuse me. And thirdly, girls are more at risk of dropping out of school, which not only threatens the girls' education, but leaves them at risk of GBV. For instance, in Somalia, is estimated, well, not for instance, but in Somalia, is estimated that approximately 300,000 girls are at risk of dropping out of school as a result of the drought. So, you can see urgent actions needed, and maybe I'll just mention 3 areas where the needs have been identified. First, we need robust gender analysis, including through the collection and use of sex and age disaggregated data, which is crucial to better understand the differential impacts of food insecurity on women, girls, men, and boys, and all their diversities. Secondly, the international community has to ensure that the drivers of risk underlying the root causes and the fundamental rights of women and girls are at the forefront of national and international crisis response, including to the food insecurity crisis in the Horn of Africa and the Sahel, and many other areas, frankly. And then thirdly, the lack of meaningful inclusion of local women's organizations in humanitarian response to food insecurity crisis has to be urgently addressed as we see severe underfunding of GBV prevention, mitigation, response services across the region. And here, I think I can say one word, Afghanistan. So with that, maybe I can hand back to you, Regine.
Well, Lisa, you just did me the most solid transition I could ever hope for, because that's exactly where I was going to go, is to ask Rain about that. But I just need to acknowledge that some of the statistics that you went through so quickly really are staggering, right? In each and every one of those statistics, it's almost like I have to take a breath through each one of them. They are so significant and so impactful. So I just appreciate you drawing those out so clearly for us. Rain, as Lisa just foreshadowed for us, I'd love to turn us now to Afghanistan. You were in Afghanistan recently. What did you see there, and what can be done in country to avert famine?
Yeah, thank you, Regine. So I got back from my latest mission to Afghanistan just earlier this week, and I was out there looking at FAO's operations. I should say, in fact, FAO's operations in Afghanistan, the emergency and resilience work we're doing there, are the largest program we're doing anywhere as FAO. Afghanistan has a population of just over 40 million, and last year FAO, with the support of the US and a number of other donors, was able to provide time-sensitive support to about 6.5 million Afghans, so a significant portion of the population in acute food insecurity. It's a very precarious situation at the moment. I was able to visit a few field locations. It's not easy for logistical and security reasons, but seeing the deterioration over the last 12 months in Afghanistan was actually quite shocking. The communities we went to, the female-headed households I interacted with, the other vulnerable households we were able to speak to participating in activities. These are households who have literally lost all of their assets. They have sold everything that they have in terms of livestock. They have taken on debt. They have lost other sources of income. There's a very real risk at the moment in Afghanistan of catastrophic collapse on the food security side. I mean, just to say that 46% of Afghanistan's population, so nearly half the population, close to 20 million people, are in acute food insecurity, and the numbers are getting worse. Now, I should say we have been able, and we are able to respond. This is another one of those instances where we have interventions that make sense, and I say we here, it's not just FAO. There are a number of established partners that have decades of experience in Afghanistan, as we do as well. Last year, FAO, for example, was able to distribute winter wheat seeds to, again, it was just over 6 million Afghans. These are wheat seeds that are locally adapted. They're drought resistant. We've refined them. In fact, 9 different types of wheat seeds refined in Afghanistan, hugely impactful. And for an intervention that costs as little as $220, a family of 7 can provide for their cereal needs for almost an entire year. If they had to buy flour on the local market, if it was available, and if they had the money, it would cost 4 to 5 times as much. And if we had to deliver it as international food aid assistance, it would cost 9 to 10 times as much. So impactful interventions that make sense. Our biggest challenge in Afghanistan at the moment, of course, is a sort of withdrawal of donors and stakeholders. And this is something we need to, we really do need to try and work against. When I talked about the risk of systemic collapse in agricultural livelihoods, that's really not an exaggeration. We are very much at the brink. Our projection for the next 3 months is that out of the 34 provinces that make up Afghanistan, those that are in this very acute phase of IPC phase 4, there was 3 of those before. The whole country is IPC 3 basically, but 3 provinces in IPC phase 4. In the next 3 months, that will go up to 12 provinces, just to give you a sense of how the situation is unfolding. I would say too that we have a particular commitment and interest in making sure that female-headed households, vulnerable female-headed households, many of whom are landless, receive support at this particular point in time. And so again, there too, there are interventions that have high impact and that are fairly inexpensive. Support for poultry, even cash distributions, cash provisions for those that have access to no land at all is an impactful intervention, and something that we're committed to doing as FAO. We were able to exchange and talk through interpreters with a number of the families that we're engaging with, and was just reminded again of how vital it is to support these people. And I should say, in these types of contexts, if we're not able to give people a chance to survive where they are, then there's a pressure for migration and movement. There's a pressure to rely on extreme and negative coping strategies, which are bad for the families themselves, but can even have a wider impact. To give one example, in Afghanistan last year, there were credible estimates that in fact the total level of opium poppy production reduced, which of course is a positive sign. Of course, as we're seeing livelihoods collapse, the incentive to go back to those types of strategies as well increases. So important to do everything we can to prevent famine in Afghanistan for the people themselves. And we also see some of the other consequences beyond that immediate human consequence if we don't get this right. So a country that needs our attention. And I think, Regine, one of the challenges we have, of course, is the fact that there are a number of deeply, deeply concerning crisis situations at the moment, all of which need attention. And I think, you know, the importance of having venues like this where we can take time and look at also contexts and countries that maybe aren't at the moment in the spotlight, but absolutely need attention when you look at the levels of need that exist and the number of people that are impacted is so important. So thank you. Let me maybe stop there and hand back to you, Regine.
Rain, I'm really stuck on the figure that you put out, which is to say that 46% of the entire population of Afghanistan is at risk of famine. And to put that in context, that's roughly the size, that means that roughly the same number of people as reside in the entire state of New York are at risk of famine. The entire state of New York. That is really staggering. So I'm very thankful for both your explanation as well as the work of FAO. I really appreciate it. Well, my sincerest thanks to Lisa and to Rain. We're going to come back to both of you in terms of when we get to the Q&A section. But which is my reminder for those of you listening, please go ahead. I see that one question has been posted in the Q&A. Would love to see a couple more if you have some questions for Lisa or for Rain or Winfred as we learn more from Winfred. Winfred, now to you to highlight the work that you and Orem have been doing. You're based in Kenya. We'd love to hear from you what the current situation is on the ground in terms of drought, famine, and food costs.
Thank you so much, Regina, and thank you for having me today. So I'm based here in Kenya supporting LGBTQ refugees residing in Nairobi and in Kakuma. So Turkana County is one of the arid areas that has really been affected due to the failed rains, like Lisa and Rain had mentioned. And this has really propelled an increase in food insecurities among the refugees who reside at Kakuma refugee camp. Kakuma refugee camp is host to about 240,000 refugees, and this country is largely an arid area, with the host communities mostly being pastoralist. So further to this failed rains, then we have seen also an increase in basic commodities and food items, and an increase in prices due to the different macroeconomic reasons such as COVID. We've seen the war in Ukraine. We have new regulations here in Kenya. So this is really reducing refugees' access to food for those especially who reside in Kakuma. As we see from the Kenya National Bureau of Statistics that food inflation between August 2020 and 2021, there was a 15% increase of the national food prices. So with this and the reductions in food rations by the World Food Programs for refugees, then we are seeing a lot of increase in the negative coping mechanism. For one, you'll see a lot of people skipping meals. We've seen from the population that we serve, we are seeing people selling off their assets, business assets, home assets, at less the value. And therefore, this is affecting their ability to engage in business and also earn an income. We are also seeing a lot of unauthorized movement to the urban areas because ideally for Kenya, refugees are supposed to stay at the camp. So most of those who are really facing challenges accessing food are now opting to go to the camp. So this is providing a bunch of protection risk because for one, there's a risk even in terms of risk for arrest, risk for detention, and then they're also not going to be able to access services because they lack the proper documentation to stay in the urban areas. We are seeing the drought also disrupting a lot of livelihoods in Kakuma refugee camp, because for one, the host communities who are largely pastoralist communities are also facing similar challenges. We've seen a lot of them, we've seen a lot of their herds dying, and therefore they are now opting to come to the refugee camp to now compete with the refugees for resources such as water, such as food, and job opportunities. So this is really causing a lot of tension because then the host communities will be preferred in terms of, say, job opportunities at the cost of the refugees. So this is further increasing their vulnerabilities and their food insecurities within the camp. Thank you, Regine. Back to you.
Thank you so much, Winfred. Let's talk specifically about the work that you lead with Orem. What are the increased challenges for LGBTIQ refugees in the camps?
Yes, Orem works specifically with LGBTIQ refugees and asylum seekers. And you find that in the camp one, it's a sort of rural area. So refugees face a lot of discrimination and stigmatization from the community, both from the host community and also from the other refugees within the camp. So you find that they get discriminated when it comes to accessing work. They are stigmatized. Most people prefer not to give them work. Whenever they want to engage in the market, then once they are identified, then they find it very challenging to access markets, even when they have running businesses. So you find that then most of them will prefer to come to the urban areas, but then they are not authorized to come here. One of the challenges they face is that this community, mostly in the camp, is mostly a youth age between 20, say, to 29. And therefore, what happens is that most vulnerability analyses that are used by humanitarian agencies then see them not as vulnerable because, one, they see them as youth. And then most of them have actually fled alone, usually not with their family. So there are people in their youth, either they don't have a large family or they have one child or two children. And therefore, when it comes to vulnerability analysis, often they are not viewed as vulnerable. So this then means then they don't benefit from, say, cash assistance that is being provided, or sometimes even, vouchers of the food distribution. So this then further segregates them. Further, you see that whenever, say, there's an opportunity for food distribution, or we have agencies that are providing vouchers, often then during the selection of these vendors, they are not selected with the lens of LGBTQ individuals and how they're able to access these food distribution points. Because then knowing the environment in which they work with that is very discriminatory, that is really stigmatizing, then if then the vendor selection is not carefully done, then you find that refugees face a lot of risk of verbal and even physical abuse at these food distribution centers, at these voucher redemption points. So then they prefer not to even go for the food, even if it's provided for them, because then what they are going to face, the risk of even that mental health, then they would rather stay, at home and see and reach out to people who perhaps might even be able to send them funds directly to their mobile accounts. And we've seen that, again, because these are people who have fled in their youth, they also have a limited capacity in terms of assets and skills. Either they were midway during school, or they had not started, or they lack the technical skills. So you find that then they don't have that the skill and knowledge to withstand all these combinations of disruptive economic and climatic factors, because this is not something that they have lived and seen and experienced. Yeah, so they find it then very challenging to cope because they lack those skills and the assets that are required, say, to bounce back after that shock.
And what programming specifically is ORAM providing to support this community?
Yeah, so for ORAM, one of the first things that we do then, we are being very deliberate in our vulnerability analysis to ensure that we are being considerate of the individual needs and risks that each person has faced, what individual experience they have faced, either at the country of origin or at the country of asylum, to ensure that we are capturing their needs and responding accordingly. Secondly, we are also trying to address some of the drivers of vulnerability through various interventions. The first one being providing emergency cash assistance first. And when we're doing this, we are really being considerate of the increased food prices to ensure then we are giving an appropriate amount. And also we are being very flexible in the mode of delivery to ensure we don't lock anyone behind simply because they lack either the proper, either mobile money transfer or any other mode. So we are being very flexible in our mode of delivery to ensure we are not locking anyone behind. We are also supporting the community in terms of, growing their own food. I was there in November and we saw quite a number of LGBTQ refugees who are usually issued with plots, trying to grow fresh vegetable just outside their houses. So we are trying to support them to have the right techniques, especially being mindful of the harsh environment and the scarcity of water, to have the right techniques to use the smart agricultural knowledge to grow their own food, and also with the potential of selling surplus for their income. And further to this, we are supporting the diversification of livelihoods with the aim of increasing the income stream. While LGBTQ refugees face a lot of challenges in the market because of the discrimination and stigmatization, we intend to conduct a market assessment that will then inform us of the value chains that will be safe for LGBTQ refugees to engage in, so that then they are able to earn a living while at the refugee camp. We also have quite a few who had established businesses before and who intend to establish businesses. So we are going to provide some financial assistance that is sufficient for them to establish the businesses, acquire the assets they need, and also providing long-term business mentorship and coaching to ensure that the businesses are sustainable. One of the other things that is very important to ORAM is ensuring that people are more resilient and more sustainable in terms of the projects they establish. So first of all, we are taking a trainer approach to ensure that the skills that we are going to provide then stay within the community, that beyond ORAM's exit, the community, the LGBTQ refugees will be able to have the knowledge, should be able to have the curriculum to continue providing the community refugees in Kakuma with financial management skills, business skills, and also the smart kitchen gardening to ensure that then there is sustainability beyond ORAM's exit. We are also collaborating with LGBTQ-led, refugee-led organizations that are already existing on the ground. And this is very important because they're on the ground, they understand the needs, they understand who is vulnerable within the community, who has the capacity to do what. And therefore, we are working with them to ensure that as the needs emerge, then we are able to support them to address the needs. And we are also doing this by also strengthening their capacity in terms of the organizational structure, in terms of the systems that they have, so that even as a refugee-led organization, they should be in a position to access funding directly, so that then they are able to assist the community as the needs emerge. And lastly, we are also building the linkages between Kenyan LGBTQ refugees and local NGOs, so that then we strengthen the relationship between the Kenyan and the host community. Thank you so much, Regine. Back to you.
Thank you so much, Winfred. It's just so interesting to hear about the work, and again, your intentionality in supporting the LGBTIQ community. I'm so thankful for your work, and I know I can speak on behalf of the CDP team that when we were able to support you through our Global Hunger Crisis Fund, we were just, it just was such a, it felt like the right thing to do, and we felt so lucky to be able to support you. All right, gang, we're gonna put one question out there in the time we have remaining. Go ahead. There's this question about multi-sector anticipatory action. What's the role of local media and journalism in preventing hunger crises? And Rain, if you could give a few examples of anticipatory actions. So maybe this is a combo of Rain. Is Rain, did we lose Rain? Maybe Lisa, this is you until we see Rain. Oh, there he is. All right, so rapid fire, 30 seconds each.
So anticipatory actions to prevent famine. So if we know that rainfalls are going to be challenged based on projections, we can pre-position supplies to keep livestock alive. We can make sure we're thinking ahead in terms of access to water for livestock and for families. We can make sure that vulnerable families have cash grants available to them, so they don't have to get into distress sales. But I mean, the whole mindset is, rather than waiting for crops to fail and livestock to die and children to be malnourished, there are preventive actions we can take to allow households to have a choice to avert famine. But this is, again, it's all about when the monies are available. The strategies are there. We know what interventions make sense. It's really about that time-sensitive funding to be able to do it. That was more than 30 seconds. Sorry.
Lisa, 30 seconds. If you have anything to add about journalism, local media.
Journalism and media, I'm not sure it's associated with that, but if I may just bounce off of what Rain was saying about the funding being available for anticipatory approach. And of course, journalists and media should actually focus on this, but on the importance of acting ahead of these crises. But for instance, these frameworks, there can be frameworks set up that have triggers that allow funding to be released as soon as a trigger is reached. For instance, the Central Emergency Response Fund, again, the CERF, has these in coordination with other UN agencies, so including FAO. Just recently in DRC, in the Democratic Republic of Congo, there was a trigger reached for cholera. So as soon as that trigger was reached, money was released that very same day. So it happens for flooding, it happens for drought, and so on and so forth. So I would just underscore the idea of ensuring that anticipatory action is pushed forward. And if journalists can help that, then all the better.
That's awesome. All right, I'm going to go to do the fastest close known to CDP webinars. So I'm going to bring us to the end here. 3 key takeaways, everybody. 1, famine is preventable. 2, when it comes to food, the anticipated reaction is in production. 3, a 2-track approach is required to respond to the urgency of the moment and invest in longer-term solutions. CDP's website, disasterphilanthropy.org. We have oodles and oodles of resources available to you. Go ahead and check it out. As I mentioned at the top of the hour, we have a webinar that will examine the impacts of the earthquakes in Turkey and Syria. It will be next Thursday, February 16th at noon Eastern. This is all the time we have today. But before we go, I want to give my sincerest thanks to Lisa, Rain, and Winfred for taking the time to share your insights and your wisdom with us. Thank you so much. For those of you who are going to take the time to fill out our post-webinar survey, I'll give you a thanks and a shout out in advance. And if you have any questions at all, you can email Tanya at tanya.gulliver-garcia@disasterphilanthropy.org. We take follow-up questions really seriously and would welcome the opportunity to hear from you. Thank you all so much and have a great afternoon.